Hi, everybody. It's Dr. Vonda Wright, and we're here in the Women's Health Conversation studio, where we are in the middle of our Smart Savvy Speaker Series. Last week, I gave a talk called Live More, how to prioritize your bodies, your brains, and your bliss. But tonight, we're really excited to have Dr. Jen Caudle, who is America's Family Doctor, here to give us an update on COVID. You know, there's a lot going on right now, and she's been talking all over the airwaves about it. So we're really excited to have her join us. So stay tuned, and we'll be right back. Hi, everybody. It's Dr. Vonda Wright again, and we're here in the Women's Health Conversation studio. And you see that we are being joined once again by Denise Ceylon-Louis, and also, just as we promised, by Dr. Jen Caudle, who is America's Family Doctor. And she is currently in practice. She still teaches. She has all kinds of residents and fellows that are learning from her every day. But something that I really appreciate is the fact that while teaching and being an academic, she is everywhere educating the American public. And so you may have already seen her on Fox Network, on CNN, on HLN, really keeping us up to date on what's going on in this really unprecedented time. So Jen, Dr. Caudle, we are so excited to have you here today. Thanks for taking the time.
Oh my God, it's my pleasure. I'm really excited to be here. So thanks for inviting me.
Oh, thanks for coming. So I know you've been at this a little while. When did you really start kicking into being a voice for keeping us up to date in COVID? Do you have a date that you started kind of?
So that's really interesting. It was definitely in January when I started because, and actually I remember I just gone away for a few days just to get a break, and went to Florida, visited some family.
Yeah.
And I started getting calls to talk about coronavirus or COVID. And at that time we'd heard about it like in December in China, but it really wasn't something we were talking about on the ground here. And literally from January till now, it's literally been this sort of upward trajectory, not only with the work that I'm doing with COVID and trying to communicate information about it, but as we know, our country, right? Like we are knee deep in it now, whereas I never would have imagined we'd be here back in January when I started talking about this. So it's really been remarkable to see how this has evolved, you know?
You know, it seems so far away in January, didn't it?
It does. Oh my gosh. It seemed like a whole world away, and it felt like something that, maybe was going to come here, maybe not. Right. But we certainly never thought we'd be shut down, and never thought, we'd have more cases in other countries and all this stuff. Unbelievable.
Well, what are the most common things as you're out talking that you are asked not only by the public, but also by the news media? What are the things we want to know the most?
So, in terms of consumers and patients and people and the general public, I get asked a lot of questions about daily life.
Yeah.
People want to know how their life needs to change or how it should change to keep themselves safe from COVID. So questions like, do I need to wash my clothes after coming in from outside to prevent the spread? Do I need to take off my shoes? Do I need to disinfect them? Should I wear gloves when I'm out and about? And what kind of mask should I get, and how should I wear it? I mean, literally all these, even like groceries, how do I grocery shop? How do I
wipe them off? Do I wipe?
Yeah, right. Do you wipe it off? Do you not? Take out? Is it safe? So a lot of practical questions is really what I'm getting asked. And then of course, Vonda, you and I have talked about some of the myths about coronavirus because they have been rampant. People ask a lot about what's true and what's not.
So if you had to summarize, those are a lot of questions people are asking you. If you give us the bullet point summary, what do we do with our clothes? Do we wipe our shoes off? What are the 10 things you're telling based on everything you've been asked?
Sure. So just very, very briefly, right now we think coronavirus is spread primarily through person-to-person contact and the sharing of upper respiratory droplets, right? That's why we have the 6 feet precautions. We also think that you can pick up coronavirus and potentially become infected by touching a contaminated surface. Now, other ways of spread are being evaluated and investigated too, but there's nothing definitive right now. So with that said, that really informs what we advise people to do. So I'm talking about non-health care workers right now, because if you work in a hospital, if you're on the front lines, what you should do with your clothes and shoes.
Completely different game.
Thank you. And you know this because you are a physician. You know that's a whole different situation. But for those of us who are not in high-risk situations, you don't necessarily need to change your clothes when you get in from outside or necessarily wash them. People ask, if it can live in the hair. And I'm not familiar with any studies about hair, but the idea is you don't need to come home and strip everything off and wash your hair and bathe and wash all your clothes. What I do recommend people to do with clothes and shoes is, I personally, when I get home, I change out of my clothes anyway, just to put on my sort of loungy, comfortable clothes. That's what I'm recommending people do. And leave your shoes at the door. It's just better to be safe than sorry. It's not just for COVID. Bondo,
it's just in general. Leave all that dirt at the door.
Right. Yes. Crap do we pick up on our shoes? So much. It's not just coronavirus potentially. But once again, we don't even think that clothing and shoes is a main way of spread if it is spread, right? Groceries. It's okay to get takeout, by the way. Contactless is the best, meaning if you don't have to receive a package given to you by another person, if they can leave it at the front desk or leave it outside. A lot of companies are doing that. What you can do is bring it in, take your food, put it in your own containers. If you're really worried about, your food being contaminated, some people say, well, what if the person cooking my food was sick? Well, this is not necessarily a foodborne illness. We do not think that's the way it's spread.
And you can always heat it up again in the microwave.
Thank you.
You can always just blast it a little bit.
Nuke it, and then you take it out. And the other thing too is, and you throw away the containers, wash your hands. But some people, if you're more comfortable, you can certainly get some Clorox wipes and wipe down the containers of the takeout. You can totally do that. Similar things with groceries. So like, you get groceries, you want to wipe down the cans. And again, look, if you don't do this every time, if you're not 200% meticulous about it, I don't want people to stress out about it. But these are just some things you can take extra precautions about,
And I do think that myself, because I got to be honest with you, it's a little hard to wipe every surface every minute of every day. It's really hard. So
it is.
But I think the bottom line,
it's not necessarily easy. Yeah.
No, but once you carry your groceries in or get the food from somebody else, wash your hands.
That's right.
Wash your hands. Just be done with it, right?
Wash your hands a lot.
Yes.
Yeah.
That is the biggest thing. Yes.
Have you been surprised with any of the crazy things people are making up about how to live with this? What is some of the craziest things? Disclaimer here, these are crazy things. This is not advice. Like, let's
you mean like myths, like some of the things that are not true?
Let's dispel a few things that are frightening people.
Yes. So, I mean, I'm African-American. There's a big myth that was going around saying, not so much now because we know Black people can get coronavirus. We see it. But there was a myth going around for a long time that Black people could not get coronavirus. Now, that's a dangerous myth. Because if you think you can't get it, you may not take the precautions that you should. Unfortunately, it's not true, right? It would be great if certain people didn't get it, right? But it's totally true. Some people have said other myths that eating garlic will cure coronavirus. That is not true. Drinking,
well, no one will want to talk to you, Jen. Maybe that's how we cure.
That helps with the 6 feet. Right?
Maybe that's how you stay away from other people. That's not a bad thought. That's not a bad thought. It's amazing, the food stuff. Drinking alcohol cures coronavirus. It does not. And also a lot of people have wondered about if they can use like drinking alcohol, like vodka or whatever, as hand sanitizer. Well, to cleanse, I've heard about that too. No good. But also as hand sanitizer, we want our hand sanitizer to have at least 60% alcohol in it. Most and many vodkas only have 40% alcohol, even though the proof may be higher. So I mean,
double whatever the proof is, it's half the alcohol, right? So somebody did ask me.
Oh, I didn't realize that. I didn't realize that was the formula. That makes a lot of sense.
It's half. So not strong enough, and don't drink the white stuff in the bottle. The rubbing alcohol. Don't drink that.
Oh my God.
That is no good. Don't do that.
Don't.
Oh.
So a lot of stuff. I mean, a lot of things. Oh, a big one is that coronavirus was caused by the 5G network or spread via the 5G network. Have you heard that?
Somewhere. I don't know.
I can't tell you how happened. I can't tell you how widespread that myth is. It is so widespread, and it is false. But it is something that a lot of people actually I'm gathering believe in based on the comments and some of the hate mail I've gotten from saying that it's not true. So
that's interesting. It must be while you're trying to educate the public, it kind of puts you in a bullseye, doesn't it? People are responding to what you say. I mean, you must have a thick skin as a clinician, and
most of the time. Yeah, most of the time. And as a clinician, I think that you would relate is that you understand, it's one thing when people are attacking, I mean, they're not attacking me. They're attacking
The
uh,
information and the fear.
the information, right? And
Right.
and feeling like, oh, I was wrong, or there's a lot of stuff that goes into it. And I realized that it's not me. You could take me out and insert someone else in, but I would be lying if I didn't say that sometimes it's tough because people comment about other things. I know you do TV as well, and I don't know if you get stuff. People are like, oh, I've had people say, comment about my hair, or they like it, they don't, or like my teeth. Who's your
Right.
dentist? Like,
Right.
it's like, oh my god.
And
So,
sometimes you think that was really good information I just gave you, and you're worried that I didn't turn the faucet off or something,
right,
So
right,
yeah,
right.
it's probably always that way, but we're thankful you've been out and about, and because I don't want people to forget you have a full-time job, and yet you're out
Mhm.
still notifying the public of what's going
Yeah,
on.
yeah,
So
it's important. Yeah.
yeah. Denise not only is a career woman, but she has like so many people in this country, sheltering in place with a lot of people. And so
Ah,
what are some of the things you've dealt with that we could talk to Dr. Jen about? Because it's not easy to keep your business going. And
Oh
I mean,
yeah.
just like Dr. Jen, she's keeping her business going, she's keeping all this other stuff going. How have you managed it all?
Well, we've been mostly sequestered in place here. Honestly, we've sent out. There's 5 of us at home, my husband and
well,
3 kids. Okay, and we've been sending him out to do the grocery shopping. But honestly,
smart.
he's in a position where he has some of those um, precursor sort of conditions that put
Sure.
him a little bit at risk, and we wonder, okay,
Mm,
should he be wearing a mask? And we
yes.
live in Ohio now, so they've been guiding us to wear masks when we
Yes.
do go out. But are there any extra things that he needs to do? We
Mm,
wonder about that. We've been
How do
wiping
you
down our
choose the
groceries,
person?
huh?
it's a
Dr.
good
Caudle, how do
question.
you choose the designated,
No,
right?
I
How
think
does
that's a
that
really good
work?
question. And I love
Yeah.
the fact that you have chosen a person, and we're talking about that because that's something we want people to do, is to not have the whole family go out
Oh
and
yeah.
potentially get infected. One person should do the shopping. So some things that he or anyone can do to minimize risk would be to shop and grocery shop at times off peak times. So rather than the middle of the day, you pick super early in the morning or late at night. The other thing is to, obviously, wash hands and things like that. But take some Clorox or Lysol wipes or something like that in your pocket, or in a bag. So when you get to the grocery store, you can wipe off the handles, and sort of feel a little bit comfortable with that. Just being mindful of what you're touching and staying away from other people. And a lot of grocery stores now have like one-way lanes and stuff. They've got arrows, which I really appreciate.
Mhm.
But yeah, the biggest thing is kind of getting in and getting out as soon as you possibly can. Wiping your hands down on the way out. But those off-peak hours really can help. Yeah, and wearing the mask and all that good stuff. But and maybe try going maybe once a week, really minimize. I'm one of these people. I live by I'm single, and there's like a drugstore down the street. Like I live near a CVS, and I'm one of these people that I'm like spur of the moment. I'll be like, oh, I think I want this tonight. I want
Yeah.
cereal tonight. And I'll go down and get milk and cereal. And then
Yeah.
the next day I'll be like, oh, I really want some granola bars. And so like I'm a person that would go to the CVS every day.
Yeah.
There's many times in my life I do, but that's not good in a
No.
time like this. You want one trip once a week, or some think ahead. So yeah, those are some things that might help. But it sounds like you guys are doing a good job.
We're trying our best here. I mean, we've gotten to
Yeah.
the point where we have a can of Clorox wipes that we keep in the
Ah,
car, the only car
good.
that's used to go.
Good.
Occasionally, we have to go to the ATM machine, either to pull money out or to deposit money, and we use the wipe to touch the keyboard.
Oh,
So
good.
we've,
Oh, wow.
so right, and just using the wipes to open up doors. And our grocery
Excellent.
store has actually been quite good about providing wipes, and
Great.
they even have a gun where you can scan your groceries as you go. Like if you
Oh my
physically go to the
gosh.
store,
Wow.
so if you have a little, I mean, you can wipe down the gun with a wipe, but you can
Yeah.
scan the groceries, and put them in the shopping cart. And even if you needed to weigh produce, there's a way to do that. It prints out, what the price is for the produce based on how much it weighs.
Hmm.
And then when you go to check out, it's, one final swipe with your credit card and you are off and on your way. You don't even have to go through a
Wow.
checkout lane. So it's been quite nice to
That's
streamline that
amazing.
process.
That's
Yeah.
avant-garde.
Excellent.
You know what
Yeah.
I've heard is people are really taking advantage of like in New York, when I lived in New York, it was called Peapod. You
Oh.
order online, they deliver it to your house.
Oh.
Or now here,
Oh.
Kroger's, our grocery store, will do that. So there are ways not to have to go out.
Mm-hmm.
It's a little bit more. But I don't know, Dr. Caudle, if you are venturing to guess how long we're going to, if people ask you how long this is going to be, is it going
Well,
to be 6
I
months,
mean, I think I'd like to
what's
get
the future?
I'd like to get your opinion on this too, you know,
Yeah.
as a clinician. I mean, I'll be honest with you, I don't think we really know. And of course, there's talk of, I literally have the White House, you know, coronavirus task force on in the background because I'm always watching that to see,
Mhm.
you know, there's been talk about possibly a second wave. This
Yeah.
could end up being seasonal. Even talk things like, you know, when this dies down, we still expect to have cases here and
Oh,
there,
of
right?
course, right.
Right. So
Yeah.
I think there's a lot of appropriate speculation about this. I think that we're going to be hunkering down at least for another month,
Yeah.
if not longer, like kind of like
Mhm.
things kind of shutting down. But what are your thoughts based on what you're seeing and you
You
know all that
know,
stuff?
well, in the state of Georgia, our peak continues to be a moving target. It changes nearly
Yeah.
daily. And so when I am asked that question or look around for that question, I really think about how long it took us to get here. And,
Mm,
you know,
that's a good
you've
point.
known about it since January, and I
Yeah.
knew about it, but I didn't start really hunkering down until March. So I don't know why I
Yeah.
would think that it's taken us 2 or 3 months to get to this place and we're not even peaked yet. And
Right.
so even if we're going to flatten the curve, many states, Ohio is doing a good job to not even reach a peak, a crescendo, but
Right.
to kind of flatten. Well, that
Yeah.
still means we have a high
Hmm.
number of people. And so
Yeah.
what that points me to is, and you and I were talking about this earlier today on another program, but what is the future? What are the things
Right.
that are always going to be different that,
Right.
you know, this has done for me is just like you, Jen, I am really good at packing a day. I can hit 9 things in a day as long as the traffic does not keep me going. I make all my meetings and we get a lot done, right?
Right.
I've always prided myself in that, and I'm not
Yeah.
really sure I ever want to get back to that, right? So that's going to be my reevaluation of the future.
Very interesting.
What's it going to
Yeah.
be like? But
Yeah.
what do you see for our future? How are we going to relate to people? Is it going to be, you travel all the time to do news, but maybe more of it's going to be like this is
I
acceptable
think
now.
things are going to change, and I'm doing telemedicine now. Like I'm seeing patients via
Yeah,
telemedicine because we're not going in the office. Like,
yeah.
and it's kind of like, well, wow, I've never done
I
it
don't have to,
before.
right, yeah.
I mean, I think the whole world is going to be different after this. Like, I think there's this whole. We're actually. I mean, maybe a good sort of maybe a benefit that we've gotten out of this tragedy of coronavirus is you know, as we talked about earlier today, it's sort of pushed, I think you said this, is it's pushed our innovation. We've had to become creative. I think these are
Faster.
your
That's
words,
right.
right? So we've had to figure out solutions. And I think that's really to our benefit. I think in many ways we may be smarter coming out of this, but I also think people are going to be more cautious. I mean, even if things open up in June, July, or whatever, you're not going to find me running around without a mask and bumping into people. I'm still going to be like, nope, 6
Yep,
feet,
stay
mask,
away.
stay away, right?
Yep.
Well, and we were talking about this at work earlier today. There are folks among us who are immunocompromised, right? So even if the group of us were welcomed back or welcomed back in shifts, say, so that we,
Right.
you know, weren't all shoulder to shoulder among each other anymore,
Mhm.
what would happen for the individuals who are immunocompromised? Would they
Right.
continue to stay home? Would they continue to work from home?
Mhm.
Or if someone in their household was? So I think there's, you know, there's going to be this extended
Yeah.
staggered period
Yeah.
before we truly get back to normal. And of course, that would be when finally there is a virus available and it's administered to a large enough
Mhm.
group for
Right.
herd immunity, as I've heard it called, right? But
Mm-hmm. Right.
yeah, but
Right.
that's some time to come. So yeah, I think even though, you know, we may be able to begin to relax some of the standards and begin to return to normal, there's still a group that is in that, you know, that truly vulnerable population that
Mhm.
needs uh, to still kind of scale back and step back and
Mm-hmm.
take care of themselves in some fashion.
It's so true. It's so true. It's going to be, I mean, our whole lives have changed so
Yeah.
far, so much thus far. I know that it's going to be a different way of living when we come out of this. I really think, and I think it's going to take a while to, it's I think it's and Vonda, I think you're right. Like in terms of like the peak, it took this long coming down. I think the after effects, the residual stuff, I think is going to last for a while.
I agree with you. I think the story is still out. I think we're not quite ready to predict, but I really appreciate you coming and taking time with us today. And
of course. It's my pleasure. It's so nice chatting with you guys.
Thank you so much. And we are back on Saturday with a sports nutritionist extraordinaire who I've worked with for probably as long as I have with Denise, 20 years. And she's going to be giving us active eating tips. So I hope you can all come back for that. And Dr. Caudle, thank you again for your time.
Thank you guys.
Bye now.
Thank you. Bye-bye.
Bye-bye.